Hey, are you still in pain after chiropractic care, PT, surgery, injections, pain management? If you are, this episode is for you. Because here's the truth. Most patients that are suffering, if you're suffering, you haven't heard this. Most pain is not because of tissue damage. It's because the pain is in the neurological tissue. The nervous system never had a chance to reset after the initial injury. So here's the main message. Most healthcare practitioners focus on joint, bone, disc, imaging, and that's not going to tell the story. Pain lives in the nervous system. And so you can't heal the tissue. First of all, if the normal healing time's already come and gone, why would you want to try to heal the tissue? You've got to reset the nervous system. See, if the brain isn't communicating with the muscles and the muscles back to the brain, then a lot of bad things happen. You don't know where you're at. Your balance is off. But more importantly, it lowers the threshold for pain. And that's not good. We got to get the brain and the muscles to communicate. And then that brings the joints back online. And that brings a sense of well-being. And you know what? Actually help with the stress levels too. You get all this being brought back online. You get the muscles functioning like they should. You get the communication going up to the brain. You get the brain raising the threshold pain, and you can move, you trust, and then your stress levels go down. And then if you mix in sleeping better at night, oh man, is that good or what? So why chiropractic alone isn't enough? It's because too many of the chiropractors have been focusing on this bone out of place or you're out of alignment. We don't do that. Neither are clinic. I focus on the neurological malfunction that's occurring at the joints and with the muscles. Everything we do is to restore that neurological input. And when we get it done, and we get it done very well, because we get results where others have failed. I want you that's out there who've never been to a chiropractor, who do not think chiropractic care could work because you think it's just about somebody cracking their back, and you're sitting there in pain. And every day you wake up and you get more depressed because you can't move, or your kids want you to do something and you can't do it, or your wife or your husband wants you to do something and you can't do it because you're in pain and you're on the verge of losing hope. That's who I want to see. That's who I want to reach out. You need to communicate with me, and we're going to come up with a plan for you. Post-surgical patients. I have a friend he's a buddy of mine. I played baseball with him in college years ago, and he just reached out to me because he had a knee replacement. And he said, Teddy, that's what they called me. My family and all the guys that I played baseball with called me Teddy. And he said, Teddy, my knee, I'm going through PT, but it's not stronger and I'm still having pain. And I said, Arnold, I got you. And I sent him a PRS unit down our art therapy, accelerated recovery performance, our MOLA unit. And I sent that to him. It's on its way down to Corpus Christi, Texas right now. And I'll give him instructions on how to do it. That is going to light up those muscles and get him going. I had another patient in the other day that had hip replacement back in late October, early November. And he goes, my left butt cheek is still hurting. My quad on that side is hurting. I don't feel like I have strength, and I've been going to PT. And I said, they never reset the nervous system. Your muscles and your brain are not communicating with, because they can't do it. They, being PT, they can't do it because they don't have the therapy. They don't have the knowledge in neurology, and they're stuck in outdated protocols. I know that sounds pretty harsh, but man, I'm seeing so many people that just don't know where to go. And I know if you're watching this right now, you're shaking your head going, this guy makes sense. I'm on the verge of giving up hope because I'm in pain. You don't do that. I'm here for you. Stay with me, okay? We're going to get that taken care of for you because I want to get you to sleep. I want you to get you out of pain. I want to get you moving. And there's home-based therapies that we can do. There's 5. There's 5 things that we can do where you can do at home. I'll cover those in the next episode. If you're tired of being told, let's do another 6 to 8 weeks of PT, or it's just going to take some time, or you just got to learn to live with it, or it's got to get worse before it gets better. or we're not sure why you're still hurting. Let's do another MRI. Let's do another round of injection. Worse yet, let's go in and do a little surgery and see what's going on. If you're tired of that, you need to get in touch, and you need to get in touch with our clinic. And there it is right there. I want you to get in touch, arkfeldchiropractic.com. There's a phone number on there. I want you to call it. I want you to set up a virtual consultation. It's no charge. Set up a 15-minute virtual no charge consultation. And I want to hear your story. I want to hear what you're going through. The only thing you got to lose is the pain. All right. So next episode, the 5 things you can do at home that is unlike anything anybody else has been telling you. So stay tuned. Stay with me. I'm here in your corner. I'm here for you. Stay with me, and we're going to defeat pain together.